The Affordable Care Act, or Obamacare, has many components that states adopt. One of those components is an expansion to Medicaid that would cover final expenses or medical bills by people who are unable to make the payments themselves. The state has three options concerning Medicaid. It can keep things the way they are, it can ask for a waiver from the federal government to subsidize private insurance purchases, or it can adopt increased coverage under Medicaid. Currently in Idaho, the county and state end up paying for indigent care, the medical bills of people without health insurance and who don't qualify for Medicaid. Between the two, Idaho taxpayers pony up more than $60 million every year.
If we accept the Medicaid option, we would have the ability to put people into actual insurance coverage rather than having them rely on indigent funding.
To sweeten the pot, the federal government will cover all of these additional costs for the first 3 years and will cover portions of the cost for upcoming years. The Idaho Legislature already missed the first year of federally subsidized coverage, but analysts argue the state would still save money by adopting the program. The expansion would also cover people with disabilities who currently rely on the state's crisis dollars.
People who actually qualify for Medicaid have access to community-based services and supports that prevent crisis when they're used properly.
So increased coverage and reduced expenses. It seems like a no-brainer, but one Idaho lawmaker has his concerns.
There are a couple of places that it expands coverage, but overall, what it does to costs are still is to be seen.
That's because the federal government is taking the lion's share of the Medicaid bill, for now. After 2020, the state will pay 10% of the costs, which are projected to only increase. Additionally, the likelihood of all the new people getting insurance coverage finding a primary doctor is low, which means more people going to the emergency room for non-emergency care. With pros and cons to all the options, it creates a unique debate for our legislature. The chances of the legislature bringing up Medicaid expansion is unlikely, to say the least. It's a hot-button issue that's associated with Obamacare. Everyone's up for re-election, and since most incumbents are seeing threats in a primary, they probably won't risk voting for a policy pushed by the president. And the governor, he hasn't been pushing it too hard either. Likely this will be another problem for another year. Live in studio, Jake Melder, today's 6 on your side.